Good morning, everyone. My name is Brian Gifford. I'm the Research Director for the Integrative Benefits Institute. Thank you for joining us for our final pre-forum webinar. Today, we are very fortunate to be hearing from Lisa Lopez, the Human Resources Director for the City of Emeryville, Colt Stander, the founder and CEO of Clutch, and Jeff Newman, who is with the Institute on Health and Aging at the University of California, San Francisco. Before we get started, a little bit about the Integrative Benefits Institute. If you are not aware of us, what we do is we provide unbiased research and insights so that employers and providers can make decisions that positively impact the success of what we call the 3 Ps: people, productivity, and performance. If IBI has a core message, it's that while everybody recognizes the cost of illness, we are always trying to underscore the value of a healthy workforce. And we do that in any number of ways. We do that through research. We do that through providing our benchmarking reports. But the most important way that we do it is by educational activities, such as these webinars and such as IBI's forum, which will be taking place at the Westin St. Francis Monday through Wednesday of next week right here in San Francisco. If you're available, please consider attending. A few things before we get started. Everybody is in muted mode, but we do have a question function. So if you look at the GoToWebinar application, you'll see where you're able to type a question. We're going to hold all the questions until the end of the presentation, at which point I will be relaying those questions to the speakers. So by all means, when you're engaged, when you're curious, when you want to know more, please let them know. And with that, I turn the microphone over to Colt Stander.
Thanks, Brian, and we're excited to be here today. Thanks for inviting us, and we're looking forward to really sharing a little bit about caregiving in the workplace, as well as supporting those caregivers to getting the most out of them as you can. With that, the 3 subjects we will be covering today focus around: 1, what is the cost of caregiving for both employees as well as employers, and how have employers been addressing this as of late? There's some really good use cases out there for us to look at. Additionally, we'll cover a little bit about Clutch and how we've been working with the city of Emeryville, supporting their employees. And then finally, we will be covering how we measure success on a program like this. As a lot of viewers and a lot of people we talk to mention, it's tough to measure sort of the ROI on this, and we'll cover actually something called VOI, which is fairly new for a lot of folks. So stay tuned for that. Before we get started on these things, though, I'd like to introduce Lisa and Jeff. I'll let them both say a little bit about themselves, and we'll go from there. So first, I'll start with Lisa.
Hello, my name is Lisa Lopez, and I'm currently the HR Director for the City of Emeryville. I've been in human resources for about the last 18 years and have worked in multifacets of the profession. And one of the things that constantly comes up throughout my career was providing benefits and wellness opportunities for our employees. So it's a constant struggle to find things that are going to benefit the employees for the city. And so we were very fortunate to find something different but useful for our employees in Clutch. And we'll talk a little bit more about that later.
That's great. And Jeff?
Good morning. I guess good afternoon for those on the East Coast. So I'm a public health and preventive medicine physician. I'm currently on the faculty at UCSF, where I'm looking at a number of issues related to aging. And I do have a background in employee and occupational health. I was in the Public Health Service Hospital, which is now defunct. We took care of merchant seamen and Coast Guard and fishermen. And then I did a stint in the employee health clinic in San Francisco for San Francisco employees, the largest number of which were bus drivers.
All right, well, thanks, Jeff. And both Lisa and Jeff will be sharing a little bit of their stories around elder care and how we're helping employees here in a little bit. With that, we'd like to poll the audience, essentially all of you, to really see who we're talking to today. And a core of that is that we really like to hear if each of you have actually had to care for an elderly loved one, whether that be from across the country, across town, maybe they live with you, or that you're just paying for some of those services. And really, the piece here is that that helps us cater how much we need to explain about the challenge, and we can go from there.
We still got a few more people weighing in on the topic. Let's give them, say, 10 more seconds.
Fantastic.
And here we go.
All right. Oh, wow. Wow. That's actually much higher than we expected to see. So for those of you following along at home, we've seen about 85% of people joining the call today have had who provided care for an elderly loved one. So obviously you guys get, each of you get a lot of the challenges that are presented with this sort of situation. We'll still cover a little bit of that, and hopefully a lot of this makes sense to a lot of you guys. And thank you for sharing that. To start with, as many of you have already seen, the experience of someone caring for an elderly loved one while working is incredibly chaotic. And that's generally because they end up having to manage a number of different pieces of this person's life, whether that be from convincing dad to get rid of his driver's license, organizing rides to get mom to a doctor's appointment, making sure that someone's eating and has food available to them, and the really fun one is around things like having disagreements with your family around what you should be doing. So not only is that chaotic, but also it's costly, in that the average family caregiver can expect to spend about $12,500 a year in out-of-pocket expenses. That's outside of insurance, outside of long-term care insurance, outside of the real medical things, and really around everything else. Even worse is that the impact on someone's life will generally cause a larger cost with regards to reduced income, as well as that out-of-pocket expenses, which amount to about $325,000 per year, or sorry, $325,000 in lifetime earnings. If for those of you with employees who are at the average U.S. income level, that's a lot. And why we've really built our program around helping those folks. To go a little bit deeper into what this experience looks like for a family caregiver, they're really simple things like helping someone get in and out of bed and helping them get dressed in the morning. This causes people to come in late, leave early, and just generally be frustrated with the logistics of this sort of thing happening. While it's really simple, over 50% of elders need support in this area. More interestingly, there's a number of tasks that you need to do on a day-to-day basis to sort of continue living. Things like getting a ride to and from where you need to go, as well as shopping. Almost 98% of elderly folks need help in those areas. And a lot of that support, while non-medical, is being provided by families and family caregivers, likely those of you who are attending. And ultimately, as this responsibility gets more and more difficult to manage, many employees end up having to make what we determine as the caregiver's calculation. So essentially what that is a lot of people think that they really have three options when mom needs a little bit more help. That either we hire someone to come to mom's home to take care of them, called home care, we put mom in an assisted living facility, or I end up quitting my job. Unfortunately, as we look at the costs of these three options across most demographics or most regions, the financial cost of these services is generally higher than the average wage in the local area. What that means is that the logical choice, the smart choice, is generally to quit your job. But we're here to help people realize that there's more than just those three options, helping people keep their jobs. So now while this sounds like a pretty intense challenge, and it is, you're probably asking, how common is this? For those of you on the phone, it's a lot of you. But over the course of the entire US population of adult workers, it's about 17%. So it's a very, very, very substantial number of people and amounts to about 34 million Americans. And the impact on their work life is also pretty substantial. If we start with just productivity costs, the AARP has actually found that the productivity loss can be equivalent to about a day a week, which is obviously pretty tough. And if we add that productivity and absenteeism with presenteeism and turnover costs, it can be as much as 30% of that caregiver's, that working caregiver's annual salary that the employer will actually bear. Most of it being with regards to productivity and turnover. Now, we're not the first people to see this challenge. And in fact, there's a lot of traction within this space in that we've actually seen guidelines that have been put out by groups like AARP and the Northeast Business Group on Health. And a lot of those groups that you see on the screen, a lot of these big companies have actually followed those guidelines and built their own programs, pulling from a various set of suppliers, as well as building things themselves internally. As you note, though, these are all really big companies with a lot of resources to spend on their employees, and not everyone can do that. Now, the guidelines that have been put in place are generally built around some research that shows that if you combine a coach with reliable resources, that we can reduce the burden of caregivers by 50%. And ultimately, the point of doing so is to help reduce their stress, help keep them healthy, keep them fiscally fit, because we saw earlier that they spend a lot of money on a weekly or on a yearly basis, and keep them loyal to your company, keeping them from turning over. And that's where Clutch comes into play. We are the third-party solution so that you don't have to build out these solutions on your own. We do that through essentially three products. We provide insights, a concierge, and a community for your employees, ultimately providing a continuous and personalized elder care support program that helps keep them at work. And we'll actually dig into what that looks like here in just a second. To breeze over those products a little clearer, we first provide content for your employees that's curated specifically for their needs, whether that be they have a family member with dementia, or they're just starting to be concerned about their family. We pair that with a concierge where we work with third-party suppliers to take care of a lot of the day-to-day tasks for those employees. Think, rather than taking mom to a doctor's appointment and coming in late for work that day, we help arrange a ride for that senior to make that happen, as well as things like grocery delivery. And then lastly, we add the personal touch by helping your employees through things like in-office support, remote support groups, one-on-one coaching, and referrals to our experts. Each of these is to really help connect your employees to other folks who really understand the space and can get them the right resources and the right knowledge they need to confidently go about caring for their elderly parents. So with that, I'd actually like to turn it over to Lisa to share a little bit about the city of Emeryville, their employee demographics, to really help compare the city of Emeryville to maybe your organization, as well as she has some good stories around why they ended up prioritizing elder care support despite the number of different wellness programs and support options that are out there in the space. So I'll turn it over to you, Lisa.
Okay, thank you, Colt. So the city of Emeryville is in the Bay Area in California and is sandwiched between Berkeley and Oakland. We are a pretty urban-oriented city, while we're quite small, though. We're only 1 square mile. Our employees, we have about 184, but that includes about 50 to 75 part-timers. Our demographics, and I apologize for not having specifics, but our demographics are greatly range from those who have just come out of college to those that are more geared towards looking towards retirement. And so, but one thing I found in common for all our employees is that there is constantly need for family care, and is through a range of childcare versus parent care. And included in, it's not just parent care, I should say that it includes siblings, aunts, uncles. There's a wide range, and it's actually more forthcoming now that we've developed a dialogue with our employees. We actually, in our business, we are a city government. Our offices are open Monday through Friday, and we actually do have a reduced work schedule for those of us who work here at City Hall, which is a 9 to 5, a 35-hour work week. And that was geared towards, again, helping employees with quality of life. But we often find that even with that reduced schedule, there's still struggles. And that brings me to why we had an interest in bringing this type of service to put in front of our employees for more information and more resources. So while we were planning, we have a thing we call Lunch and Learn. And these are hour-long, once-a-month sessions that we give to employees where we provide lunch and we bring in different people from the community, different businesses, to give them access to what's out there in terms of wellness. Everything has been ranged from yoga to what we're going to talk about now, which is services to help with balancing life, work and life. But so what was happening is at the time I was approached by a gentleman in the community that wanted to come and speak about seniors and the impact it has on the workforce and employees caring for aging parents or siblings. And while that was being broached as an idea for a Lunch and Learn, I actually was dealing with two separate employees that were having issues with parental care. One actually had to keep canceling meetings, and we were going through a budget crisis at the time, and these were meetings that were the employee was representing the union, and we were meeting with the city manager, and the meetings had to keep being rescheduled because unfortunately this employee had her mother go into the hospital for emergency surgery. So she was and her mother lived up in Santa Rosa, which is about an hour or 2-hour drive with traffic from Emeryville. So she was constantly struggling, she was stressed, and on top of that, she's trying to do her work and in her role as union, which is an additional thing, trying to balance all that. And then one of our directors actually came and said he had to take an emergency trip to the East Coast because his father had fallen and he needed to go back and handle everything because his sister was there, but she was burnt out and his brother wasn't assisting. So there was just a lot of need. And so this was actually just a matter of perfect timing. The gentleman who wanted to request the presentation came forward, and Colt was one of the speakers and brought forth this program that he was running called Clutch. And it was just the right thing at the right time. We found that it wasn't something that we had even visualized, but as soon as we heard about it, and we had a great attendance at the Lunch and Learn, which was unusual for such a resource. We usually have more attendance at things that talk about yoga and personal wellness. But this really hit a chord with our employees. We found that even employees that were at the stage where their parents are still vibrant and active and independent, were starting to think about the future. And whether it's the flu bug that hit and their parents were knocked down, they kind of got a dose of reality, or there was a broken bone, but their parents were still functioning, it actually caused employees to become more aware. And so we had a great attendance at the presentation that Clutch and Colt gave, and we found that the employees were really responsive to it. And during that session, I shared one of my stories, which I actually have lived up in the Bay Area for the last 20 years. My mother at the time, she has since passed, but she lived 4 hours away in Santa Maria, California, and I was considered her primary caregiver. So in the beginning, it wasn't that difficult. She was pretty independent, feisty. She wanted everything done her own way. She lived in her own home, which was what we wanted. She had a bout of pneumonia that changed all that. And all of a sudden, I was going down it started as every month, down to Santa Maria, 4-hour trip, and you can't fly there, you have to drive. And just doing little things for her, taking her shopping, because my aunt, who was her sole source of transportation, was also not feeling well and had been diagnosed with breast cancer. So there was just a lot going on when I realized I didn't have a lot of resources. And plus, I was 4 hours away in a completely different county. And it was very limiting trying to find resources for my mom. And my mom was a handful. So it's not like, she was just kind of going along with the program. She would take off to the casino and I wouldn't be able to find her. She wouldn't go grocery shopping and spend her money on lottery tickets. So there was just a lot of things that made caring for her long distance very interesting. When my brother moved in to help, in a certain sense, it was a help, but at the same time, she started getting even more progressively worse with her dementia. Her health she was struggling. And so she wouldn't do simple things like take a shower. So I would get a phone call in the middle of a budget meeting telling me that I had to tell my mom to take a shower. And so we'd be on the phone struggling, fighting, because she was not going to be told what to do because she was a grown-up, her words. And so it was at that time that I realized, my God, there's just something missing here, that I can't find resources in my county to actually help with my mom. And my brother had no resources. The best thing was a counselor that focused on senior issues, that was willing to come to the house to kind of talk to my mom and see what she was. Well, he ended up counseling my brother because as a caregiver, my brother needed more help than my mom did because my mom didn't feel anything was wrong. So I could relate to some of the stories the employees started telling at the Clutch presentation. There was a lot of interest in what this service provided. So what we did is we invited Colt back for a presentation on his own, just to talk about Clutch and what they provided. And it was met again with great interest. We had a better turnout than we did at the first presentation. And even people who said, oh, my parents are still pretty independent, but I need to plan for the future. We're interested in doing this. And that was good for us in HR because we were not only able to provide a new resource and give something to employees, which, by the way, was very cost effective for us. And I'm sure that maybe Colt will talk about how he provides the service, but it was not only cost effective for the city of Emeryville, but the employees were actually really grateful to have this resource. Our objective, in providing this was hopefully getting our employees resources and support so that they wouldn't feel pressured to take time off, wouldn't feel pressured to leave work and feel like their job was in jeopardy. We're a public sector environment, so our employees know that they're protected by a lot of laws, and including FMLA. However, even though they know they're protected, that doesn't ease their pain in thinking they're not getting their job done. So we wanted to make sure, we're a small city, and so we know each other a lot. Our employees, we're more of a team family environment than an actual business environment. And so knowing we can help employees, but still providing a service that actually we're not getting into their business is really helpful for us. So that is our story with Clutch.
That's great.
Yes.
Actually, that touches on a lot of things to come up here too. So first off, thank you, Lisa. So after we started engaging with the city of Emeryville, we have a couple stories to sort of tell you on some success stories. Unfortunately, Lisa's unable to share these, largely because we keep the stories of the employees and the support that we provide very separate from Lisa. And in fact, only due to this presentation, I think that you'll hear these sort of stories. The first example is around a man named Brian. Obviously, we've changed his name, but his story gives a good example of how Clutch has been able to help the workforce. Brian's mom lives in a retirement community in Southern California. She's still driving, but he doesn't want her to. So he's really concerned about essentially taking her driver's license. He's got family who lives in Southern California with their mom, or at least nearby, but they are really disengaged, not interested in helping, largely because they don't think that there's a problem. So really, Brian is just concerned. He's generally just concerned about what's coming. He doesn't know what's coming, and he's trying to figure out what he's supposed to be doing. Our team ended up working with Brian and helped him in a couple different ways. The first one is that they provided a number of how-to resources with helping convince mom to get rid of her driver's license. And I say convince mom to get rid of her driver's license because you can rarely take something. You can only convince someone to give it up, especially at the age of some of these folks. The second piece, which was especially interesting for Brian, or that he found especially interesting, was what we called building a care team. And a lot of folks generally think that their quote-unquote care team, or rather the team of people that they've built to help an individual are things like doctors and nurses and brothers and sisters. And the reality is that we help them realize that it's actually larger than that. It's actually softer than that. It can be the cafe that dad goes to every morning for coffee. It can be the mailman who comes by once a day, or the gardener who comes by. These sorts of groups can all keep an eye on that family member. And in response, Brian was really appreciative of this, and that he was reassured that the concerns that he had were not as great as what he thought, and that he was doing what was right at the moment, really helping increase his confidence that he was doing the right thing. In a more difficult situation, we had Becky, whose mom lives nearby here in Emeryville, actually about an hour away, by bike and by bus, because Becky is commuting to see her mom by bike and by bus on a day-to-day basis. She's been neglecting her health because of taking care of her mom, and has seen a lot of weight gain. And interestingly enough, she and her mom really benefited from a local pet therapy group that they had happenstance come across in the recent weeks. As we worked with Becky, we realized that the pet therapy thing was really something that could be used to help her and her mom together, as well as to help her. And so our group actually found a local pet therapy group to come visit her on a regular basis, her and her mom, as well as we realized that she was having a hard time with her self-care and needed something that was easy to do, possibly while at home or while visiting her mom, which excluded things like going to the gym and some of those sort of obvious things. With that, we connected her with the Calm app, which is essentially a mindfulness product that she really latched onto and really found useful. And while that may not be the right solution for everyone, it really ended up working for Becky. And so with that, I'm actually going to turn it back to Lisa again to sort of share on what impact this has had thus far. For full disclosure, we've only been working with Emeryville for a few months, so we haven't been able to see a lot of the massive changes, but I think that there's some cultural pieces that have changed even in that period of time.
Yes, so our employees, the feedback that we've gotten is the fact that we've actually incorporated an actual resource for them to use. Most of our wellness in the past, which is a good thing, has focused on health and mindfulness and techniques to calm and homeotherapy, and which is all great for individuals because everybody's interested in different aspects, but they're all theoretical, as it points out in the PowerPoint. They're all things that are in concept for the employees, and that they can't, it's not a hard, fast resource. What we've tried to start doing with our Lunch and Learns is actually providing actual physical help for them, in whether it be in in caring for and being a caregiver, or some other a gym membership or a dance class or something that actually they can go to and have a benefit from that. They can actually measure what they're doing. And to incorporate both of those things, because we think it's important in HR that it'd be a more well-rounded approach to helping our employees, because we can give them a lot of theory, a lot of ideas, a lot of blue state eating type of presentations, but to actually give them phone numbers, people, agencies that can actually kind of walk them through some of the things they're going through. And we do have an EAP program, but I was very surprised to learn when I got here that the employees didn't even know what EAP, which for those of you that don't, it's an employee oh my gosh,
assistance
program. Thank you. I totally blacked out on it. And so this actually operates in the same manner. They call a number, they say what they need. But again, it seems so far away that a lot of our employees just kind of said, oh, that's only for people having, disciplinary issues, or for managers to call so they can get mediation actions, which it's not. However, so that was our kind of go-to when we thought, you know what, we need to start actually bringing these resources to them. We have a captive audience. We advertise these lunch and learns throughout the city, and we actually encourage directors and managers to push their employees to attend if they feel this is something they need to know. And in providing these actual hard resources, we're giving employees an outlet, a place where they can go for help, because HR can only go so far in providing things for their employees due to financial limitations, due to staffing limitations, and this way it's a broader reach, and our arms reach out a little bit further just to make sure our employees feel that we care and that we're here to help them in addressing some of the things that they're dealing with in their daily lives.
That's great. That's great. Thanks, Lisa. And I think what's interesting too is that something you said earlier really resonated with this sort of shift as well, in that by having parents, it actually ended up helping sort of shift the conversation already within the office and the culture that it's okay to have this sort of challenge. It's common. We can talk about this sort of stuff, and that actually makes a big impact as well. So thank you very much. So with that, we at Clutch we hear a lot of these great responses as well. Things like that people don't even realize what resources they have available to them, and that they know that there is just a way to solve what they need to do. And a part of that is to do with the culture, the cultural shifts that we see within companies as well. Now with that, all of this is built so that employers benefit, with the goal of reducing absences, improving productivity, and loyalty and retention. But measuring that is a different story. And so how do we measure a lot of that stuff? And how do we make sure that groups like the city of Emeryville are actually seeing a benefit, a quantitative benefit, outside of those anecdotal stories? The anecdotal stories are very heartwarming, but it's sort of tough to tell your CEO or your CFO about that sort of thing and expect them to get a good response out of it. So with that, as we measure the impact of these sorts of engagements, we turn to the National Business Group on Health. So it's a group that helps lay down some guidelines on providing measurements for this sort of thing. Historically, a lot of folks have been looking for return on investment for a benefit like Clutch, and the struggle around that the entire industry sees is really with regards to how we measure the quote-unquote benefits. And traditionally, that's purely in healthcare costs. But as we've talked about today, a lot of that benefit comes from productivity, workers' compensation, and generally keeping people at work, both by reducing turnover as well as presenteeism. So then the question is, how do we measure value on investment? And I think, Jeff, I'd love for you to chime in if I'm missing something here, but anything that we've missed at this point?
No.
Okay, perfect. So there's essentially a few ways to measure this VOI, and we're borrowing all of this from proven research out there that's been done in the past. And so the first piece is that we measure absenteeism through a process, or rather a group called MPAC, which stands for the Employer Measures of Productivity, Absence, and Quality. Really super simple and generally data that most groups have on hand, as well as the city of Emeryville. Is that right, Lisa? You guys have this data, right?
Oh, yes, definitely.
Right. Commonly, in core to measuring this sort of thing is making sure that we're using data that people already have, that already keep track of before our engagement. And so MPAC really points us in the direction of essentially looking at the number of paid and unpaid sick days, as well as FMLA, over the number of employees that you've had. Comparing that based on last year, or essentially pre-engagement versus post-engagement, and looking at all employees, not necessarily just the employees that engage with the system. So Anything, Jeff? Perfect. The next piece, another very easy one is looking at turnover, which very similar to the previous data is just looking at turnover from the previous year versus turnover for this year by the total number of employees. Super easy stuff, but it really helps emphasize it, see if there's some sort of reduction in that turnover. And this is usually at a pretty high cost. Again, we're looking at this for all employees, not just for those handful of folks who are engaged with the program. It's just too difficult to sort of sort them out before and after. And the last metric is actually the much more interesting one. So we borrow this from Stanford in what's called the Stanford Presenteeism Scale. First off, presenteeism is we find it very exciting, very interesting. It's not incredibly well understood across, especially say CFOs and CEOs, but this scale really helps add some color to that. In short, it's essentially 6 questions with a strongly agreed, a strongly disagree scale that we ask the individuals who are engaged with the program. And generally these questions are administered at different increments, and the person taking the 6-question the 6 questionnaire is thinking about how their experience has changed over the last month or so, or rather before and after an engagement. Now, as Lisa was noting before, that while they have a family type community here at Emeryville and resources to help keep people at work, being productive is another story, and making sure you're not stressed is another story. And so these 6 questions really help pull out what type of support we're being able to provide those individuals. And so we've actually provided those 6 questions because we think they're actually really important and help illustrate how we can find that nuance within this. So the first question is really around stress and how much we've been able to reduce that stress due to aging parents. The second is around helping someone's essentially productivity in handling those difficult tasks that they need to do, whether that be a budget that you're getting called out for because of having to take a shower, or because mom had an emergency operation. The final 4 questions are really based around measuring distraction from work, the feeling of hopelessness, judging focus, and ultimately energy. And so while these all seem like very vague, sort of soft pieces, this process really helps us quantify that in as much of a way as possible. And so we can take that data along with the turnover and the absenteeism data, and we can be able to say, our employees are healthier. They have seen a change. They've seen how much of a change that they've seen, and we can take that to those folks who are making these decisions, or rather helping fund these sort of things and that sort of thing. Jeff, am I missing anything?
No, these are general surveys about presenteeism, but I think it's also useful to think about specific productivity measures in your particular company.
Fair.
And that might be even more valuable to get a handle on the benefit of this program.
I think that's fair. And so a couple examples of those sorts of things are things like sales teams, sell-through rates on factory floors. It could be the number of widgets created. In a coffee shop, the number of coffees made, that sort of thing. Is that
right?
A good way to think about that?
Yes.
Great. Well, cool. So with that, we're actually coming to the end of our prepared information, and the real piece here is that what we've seen with a number of companies is that they hear the problem, they hear the solution, they're excited about what we can do for them, but they don't know if there's actual interest within their company. As Lisa noted, what we did with them and what we're offering for each of you attending today is that we can provide a complimentary class either in your office or online, depending on what your interest is, to really see who shows up. If no one shows up, that means there's probably no interest in elder care support, which is okay. But if a lot of people show up, it can help ensure that that you're spending your time and energy on something that's actually going to be used, and that's our goal ultimately as well. So with that, I've left my contact information on the screen there. Feel free to reach out to schedule that complimentary class to really help us work with you to determine if there's a real interest in this type of thing among your employees. I'm sure there's a lot of interest among you, since a lot of you have dealt with this yourself.
And if I could add something, when we first scheduled the clutch presentation, my analyst and I were a little concerned that that the numbers wouldn't be wouldn't be high enough, or that Colt would be disappointed in the attendees. We were very gratefully and pleasantly mistaken. Our employees actually, even people who had never come to a lunch and learn, actually attended the one to talk about Clutch's services and ageism, and dealing with aging family members. So, if I would say to take a chance, even if you feel that there's not quite the interest, and it hits all age groups. Surprisingly, even some of our younger staff members actually participated. As I said before, even though they felt that their parents were pretty independent, they wanted to be ready in case that changed.
Yeah, I think that's really good to point out, Lisa, is that I would say a lot of the interest that we see from employees is actually among millennials who have parents who are, let's say, 65, just retiring, but probably have diabetes or some heart condition, and they're going, everything's okay right now, but like in a second, everything could be different. And they're going, okay, I need to prepare for this because mom lives in Ohio and I live here, and last time I checked, it's really hard to fly back and forth. So you'd be very surprised. Be very surprised. And we're here to basically help you determine if this is a real thing or not for your organization. So with that, that's all we've had prepared, but we're really excited to address any questions you guys may have. And I think Brian will probably hear from you with that.
Thank you all for the presentation. I really appreciate seeing the mix of the personal stories, the statistics on elder care, and also the approach to trying to get a handle on what is the value of having people feeling well enough, not just about elder care, but generally, to be performing at a high level on the job. So thank you for that. One of the first questions we got was about the gender mix of people who are caregivers. I think we've all seen statistics, and frankly, we've probably all seen it in our own lives, that women tend to do more of the parental caregiving or caregiving of their parents than men. And so I wonder if this impacts the approach to, for example, communicating the types of services. Do you see in your experience that men and women respond differently to different forms of assistance?
So we'll start off with a confirmation that yes, about 75% of quote unquote family caregivers are women. I think the interesting thing to note there is that this is sort of self-reported and quote unquote primary caregivers, while we work with folks that don't necessarily consider themselves a caregiver, as well as are remote and they consider themselves like a secondary or a support function for their family. Now, I think with that, we see less of a impact with regards to the type of outreach and the type of programs from a male to female or a gender sort of perspective, and we see it more in a distance perspective. So if someone is caring for a parent across the country, they generally need referrals to various resources. If that parent lives with them or very nearby, usually it's things like products and more local resources. So it's more about, generally we see different requests based on those two pieces instead.
Lisa, are you seeing something similar at the city of Emeryville as well?
Well, if we go just by the people that attended the presentation.
Yeah, it was almost all women.
Almost all women. We had two of our directors that showed up, and that were men. So yes, we are seeing that. However, it's funny because I think the email that I sent out alerting all of our staff to Clutch's services, I think that was what more the male population was waiting for.
I was just saying, we actually had, that's a really good note. So we sent out or rather, Lisa sent out an email blast where we encourage people to sort of sign up for the regular content. We actually saw half of those were men.
Oh, that's great.
Interestingly enough.
Mm-hmm.
And so there you go. Maybe that's a real good piece of that, is that maybe the women show up in person a little bit better and men respond to the online component a little bit better.
Another hypothesis, and maybe this is, we could do some research in
Yeah.
this area, is that while men may do less caregiving, and that may be changing, they may be distressed about what's going on with their parents, and it may be interfering with their performance.
Mm-hmm.
So it may be a much bigger problem among men than we're aware of.
Fair. With the reluctance to ask for help and things of that sort.
Great point. And the follow-up question would be, if you think of the instance where you're going to have people in the workforce, men or women, who are going to cut back on their hours. Of course, this is going to impact their earnings over the long haul, maybe not immediately if they're salaried. And of course, people who drop out of the labor force are going to lose a lot of earnings. It's going to impact their retirement down the road. So are there efforts made to, for example, I don't know what would be the right term, but kind of cross-pollinate, let's say, the elder care services with some of the more general financial and retirement services that a company would provide? How much emphasis do you have either at City of Emeryville or for Clutch generally?
Well, for a public sector agency, we actually are fairly fortunate to have our retirement and our deferred comps all really kind of built into the system so that our employees are protected from the beginning when they start working here. Our focus more is on the idea of absenteeism and that infecting. So when we have paid leave, our employees get a certain amount of leave every month, whether it be sick leave or vacation, and our directors, management have admin leave. But when they start burning through that, that's where we step in, because we never want our employees to be forced to go on unpaid leave. Because then, yes, that starts impacting their quality of life because their paycheck's not as much. It can start impacting their retirement because their salary levels go down, and our retirement system is based on the 3 highest years of pay. So we try to work towards balancing at the beginning so they're not impacted financially that way. And it's more of an immediate impact, because if they're on unpaid leave, they're not getting money to pay for their daily expenses, their bills, all those things, which adds to the stress level. So we try to bring resources to help them kind of to alleviate the need to call in, and so that they feel comfortable, because not calling in doesn't necessarily mean you feel comfortable. It just means you're at work. So we want to make sure if they're not calling out sick to go care for someone, that they feel secure that that person is being cared for, whether it's a child, a parent, anyone in their life.
That's great. And then I think also something for us to note is that at Clutch, a lot of what we do is we're a hub of knowledge on what's available for you as a family member, as a caregiver, whatever you want to call yourself. Part of that is making sure that you as an employee are utilizing the benefits that that already exist for you. And one of those benefits that frequently exists and is underutilized in the elder world is your FSA account. And that frequently these accounts can be used for elder care based costs, and a lot of people don't even realize it. And so by helping bring light to that subject, it actually increases utilization of some of the other benefits that employers are already investing in that are maybe being underutilized as well.
Great points, and I want to kind of stick with this theme of preemptive services. You know, we know from the Bureau of Labor Statistics that all of the growth in the U.S. labor force over the next 10 years is going to be from workers age 55 and above. The other age groups are going to just remain steady, and in some respects, they're going to shrink. And we can expect that when you're dealing with employees age 55 and above, a lot of these people are going to find themselves taking care of senior parents. So this is an issue that's going to become more acute. And so, you know, when I'm thinking of the concierge services, a lot of these are really important responses to what's going on in people's lives. Any kind of really practical guidance on what employers should consider to preserve employee productivity before it becomes an issue? I mean, how do you get this outreach to people who aren't yet taking care of their senior parents, but very well likely could be?
Mm-hmm.
I think from an employer standpoint, we really encourage, well, we have alternative work schedules available to maybe balance out so that if they have to come in late one day because they have to take somebody to a doctor's appointment, they don't necessarily miss work time, and that alleviates some of the stress of having to call out sick or use their time. So we try to educate them, so not necessarily in that context, but just about, you know, work-life balance. I think that's what our message is to our employees, no matter what their age or what their situation is that we really try to encourage work-life balance and resources, whether it be meditation or, you know, grocery delivery or something that will help them just take a little stress off their day, so it makes it a more well-rounded picture. So that when they are ready or are in need of the services, they know where to go and they know what to do. So we do try to do a preemptive surge of information, mm-hmm. so that by the time they do, and as I said earlier, our employee bank is a mix. I mean, we have people 5 years away from retirement. Some of us are 10 years away from retirement. And we have people that just started with us that maybe have worked here 5 years and have a long way to go. And so we try to do something that reaches both groups, which is difficult because they're in both different stages of life. And that is why we say this is what's out there for you, not, you know, and try to phrase it in a way that's inviting to everyone, not just the person that needs the service.
As with other aspects of healthcare, prevention is usually better than dealing with crises. So thinking about this in advance, and my baby boomer generation, we don't like the idea of winding up in a nursing home. We don't want to be in the hospital at the end. So a lot of these new residential care opportunities, home care, innovation might be very valuable to prevent the kind of crises that we want to avoid.
And then from the clutch perspective, to come back to your question on sort of how we help make sure that the stuff is done preventatively, we first start with groups with an in-office session, which helps us grab people who are just curious, who are a little concerned, and then we maintain a relationship with them via curated content that we deliver on a regular basis. We find that actually helps keep what we're doing top of mind, as well as keep people educated on what those options are, especially with regards to those concierge pieces and other resources. That also means that folks like Lisa don't need to be constantly pinging people up where this sort of program isn't applicable, aka getting people very annoyed with it. So rather, what we do is we work with Lisa to send out a handful over the course of a year, a handful of emails and/or classes where we can engage with someone, and then it's our responsibility to make sure that those folks are educated.
Very good. We're coming close to the end of time. So let me give the speakers the last word before I close out the session.
I'll leave it to you guys two first. Any final thoughts?
Just that I think to be a well-balanced workforce, whether you're an HR director, a manager, or a supervisor, thinking kind of universally about an employee's welfare, not just their health, but resources, things that we can provide to employees. And there's a lot of things out there that you can provide at low cost. You know, we're a city government, so we're very limited in the finances that we can actually just kind of spend. So I think I would encourage people just to be proactive and be creative. And you just never know what is actually going to hit the target with your employee group. So it's good to be kind of broad in thinking what you can present to them and have ready for them as a resource.
Yeah, I just say that there is a lot of innovation coming up, and there may be apps and possibly even robots that may help with some of the situations. But it's really going to need to be personalized, and the idea that there's an expert who can really help figure out what's appropriate for the individual aged person. That's critical.
Right. And then the final thoughts from myself is really around, you know, we've built Clutch to be to provide that ongoing support for the employees who really need some help, whether that's because they're concerned, they're worried, or because they're actually having a really hard time balancing work and life. For those people who are on the call who are curious to hear if this actually works for them, whether because their employees may or may not be interested, or they may or may not have the budget, I encourage you to reach out. The first piece that we're excited to come chat with you to essentially help validate that need at a zero cost, no risk sort of way. And then we frequently engage with employers in a way that they bear very, very little risk, very little financial risk, unless the program is actually used. So with that, you know, typically we see costs well below $1 per employee per month, and that's even with substantial engagement. So come talk to us. There's a really good chance that it's much cheaper than you expect, and that you'll see a much higher engagement than what you'd expect. So with that, thank you very much to IBI, as well as the city of Emeryville, and Jeff today for joining us for this and helping educate the world on elder care and how we can help employees manage all of their needs. Thanks, Brian.
Thank you very much, and thank you all for joining. We will put a recording of this presentation on our website if you want to refer back to any of the information. And I look forward to seeing you at IBI's forum next week. Have a good day.
Thank you.
Good job.
It was fun.